So can you just, in 2 seconds or less, so Ginger, we aren't taking in her into her time, but can you tell me about your wine tasting that you're doing? I thought I saw that, and I think that's pretty interesting.
Yeah, sure. It's called a virtual wine tasting. The concept is you sign up for it. You're basically paying for 3 bottles of wine plus a donation. We will get the bottles of wine to you from a company in Michigan that has the wine from 3 Michigan wineries. So we'll get the wine to you, but on the 24th at 8 o'clock, the expert in wine will conduct the actual wine tasting, telling you to drink a sip of this and here's what you should find in the taste. The normal things you would get if you went to a wine tasting.
Sounds cool.
And as I say, so there's a donation involved, but you're also buying 3 bottles of Michigan wine. It's all Michigan wine.
Nice. Good idea.
And anybody can join.
Michigan wines are so good. We were just coming from Shanty Creek near Petoskey. So many beautiful, a lot of new wineries are there.
All three are from a winery up by Traverse City.
Oh, they're wonderful. Yeah, in Petoskey area also, we were there for a day or two.
Yeah,
good
so,
wine.
We let the wine guy choose the 3 wines. The concept is you can have friends over, so they could do the virtual wine tasting with you. I'm expecting the people who participate will be able to comment on their wine while the guy talks about what you should be tasting.
That's interesting. Very interesting, Phil.
So we'll see how it goes. I'm looking forward.
No, I think looking for all new ideas. These are great ideas. They're all coming now. We never had them before.
Well, it fits in perfectly to the COVID-19 world we're in.
Absolutely.
Can still be Rotarians and drink wine.
Oh, of course.
You don't need to go driving, and you don't need to get dressed up to go out, but you can still enjoy the company of Rotarians and guests.
Yeah, sounds great.
All right. Ginger, on my screen at least, you're right in the middle, which is cool, since you're our speaker. It sounds like most people here are aware of who you are, but would you mind a very, very short introduction before you get started? Okay. When you're ready to share a screen, if you're going to, let me know and I will turn it on.
Yeah, I don't have any to share.
Okay, good.
Yeah. So I'm Ginger Barrons. I've been a Rotarian since January of 1989, but I actually was a Rotarian a little bit longer than that. I started becoming a regular guest in 1985 in the club here in Novi. My family members had chartered that club, and I had a lot of friends there. And they were very progressive and wanted women with them. So when the time came that women could join Rotary, I was one of the first 3 inducted into that club officially. But so I had been with Rotary long past, right when at the convention started, that they announced that in 1988 they would start the campaign to eradicate polio. But along the way, I did a lot of other things, a lot of community service projects. I was chair of our senior group for 23 years, our senior citizen projects. And then, of course, I also volunteered at the district. I was an assistant governor. I was on the foundation team, which I really loved because at that time, the foundation team wasn't so split into different sections. So you got a taste of everything from global scholars to grants to raising funds to the polio. And then I landed kind of as Keith Koch's assistant, co-chair of the polio committee quite some years ago, thanks to Don Chisholm and Janet McPeak. So I told Phil I had a couple of objectives, and but along the way I had waited for the announcement, and it came. So I just want to share with you, if you are on Facebook and you didn't see my enthusiasm over the last and a half, you probably are in a bubble, because I must have posted everywhere and I could that Africa is now polio free. And that's such exciting news. It is. And, you know, I just want to congratulate all of you. Farmington Rotary in particular, I have a great knowledge of their dedication to the polio campaign. And so I'm just really proud that Rotary has accomplished this. 47 countries in Africa are now polio free. And so we still have some challenges in Africa, and I've been getting a lot of questions about that. And the challenge is that we still have the vaccine-derived polio that is circulating. And people want to know, well, it's not circulating because it actually comes from the vaccine. But people want to know what we're going to be doing about that. And so that is something that will take care of itself. They are watching it and monitoring it and hoping to get in the new oral polio vaccine, which doesn't have that risk. It's just now in production. It's been approved, and the supplies are low right now, so it's going into more critical areas. But we will begin to use that as soon as production is high. We'll begin to use that worldwide, and that'll make a big difference in never seeing any vaccine-derived cases. But we will vaccinate for 3 years everywhere in the world until polio is gone. So it's, you know, it's a challenge to get places where the vaccine is, there might be under-immunized kids, and that's when the vaccine-derived polio happens. So anyway, that is the good news of the day. Africa's polio-free, and the fact that that happened during a pandemic leads really nicely into what Phil had asked me to talk to you about, and that is the COVID-related, how COVID-19 related to polio, and you know, and how is it that we are making progress in the midst of a pandemic. Today, our numbers are 65 cases have been recorded in Pakistan and 37 in Afghanistan, so 102 cases. We did not have any cases this last week. In fact, the last case that's been recorded was July 24th, so it's been quite a while. Sometimes the reporting comes slow, but as of right now, the 24th of July is the last reported case. So those two countries are still a challenge, and there's a lot of reasons for it. Pakistan in particular has a lot of militancy there, and there's a lot of misinformation about the polio campaign, and a lot of it was coming from government sources. And I think we've cracked that. I think we're getting more cooperation now. But for every child that we find polio, we know that for every 2 children that we find polio, that there are probably 10 others out there. So that's the sad news for Pakistan, is that, you know, we've got to keep doing that surveillance, and we've got to keep getting at those kids that are under 5. We know that during COVID-19, we had to stop National Immunization Days, and that actually meant that about 40 million children under the age of 5 did not receive a vaccination in the schedule that we would normally be doing it during the lockdown. And so we know that led to a spike in cases, and so our cases might be a little lower. But during that time, there was a lot of things that were happening. We were very proactive where we could be. We continue to do the tracing and the tracking of polio because that didn't require as much face-to-face contact. And then in our health centers, or in the country's health centers, where children would come for health care and for routine vaccinations, we can continue to give vaccinations there. Rotary continued to fund. And of course, we continued to fundraise. And so that's one of the things that happened. But along the way, one of the biggest things that I know Phil was interested in was, how is it that we helped with COVID? And it's kind of similar. The Global Polio Eradication Network, we led really critical support to a lot of communities for COVID-19. And we had decades and decades of experience in dealing with virus just from our campaign to stop the polio outbreak. So our workers played a very important role in helping those who were dealing with COVID. We allowed them to use our infrastructure, for one thing. So that helped them to develop and identify cases of COVID. And then we allowed them to use our network, basically our computer network, that helped them to trace and track, to figure out how to do all of that and where to go. And one of the biggest supports for COVID was just getting people into routine health care. So that's something that our polio campaign has led into. When kids come into the centers, the health centers, as opposed to the national immunization days, they receive all of their routine vaccinations that their country is giving at the time, so along with polio. So we used those years of experience to also teach about how viruses spread. And where we could, we set up hand washing stations. Anywhere where people congregated, Rotary put forth the resources. And you probably saw a lot of that being advertised from Rotary International, that we were out there, we were delivering masks, we were teaching hand sanitation, we were teaching don't touch your face, we were teaching distancing. And so we were really able to help them respond in ways that some of the countries were very unfamiliar with. And so that was really a good thing. We know that we had thousands, not just a few people, but thousands of workers from the Global Polio Eradication Network working on COVID. And so they went into areas where there were outbreaks and lent their expertise and their support. And so that was really, really helpful. So we did the case detection, the tracing. We also administered testing. Our workers quickly got trained in doing that. And so where there was testing equipment, and then the biggest thing was the data management. And that was something. We did a similar thing during Ebola. You might remember that we used our network to help during Ebola too. And we were actually credited with helping with that emergency response, prevent that from being a much bigger problem than it was. We also lent equipment. We have physical equipment. So we have some vehicles in certain spots in the world that can get into places that, you know, a typical car couldn't get into. And we allowed those countries, their health workers, to utilize our vehicles. We did not send our polio workers out to give vaccinations, but we allowed them to use our vehicles then to go out to track for COVID. And so, so it was our vehicles and our computers were two of the big things. I'm trying to think, one of the ways that we taught about COVID and polio at the same time was just talking to countries about strengthening their health systems. How could they, you know, build a better health system? What could they be doing in their country to improve global health? Because we know that improving global health makes everyone a little bit stronger when a virus comes their way, to being able to fight it. We're also very good at emergency outbreaks. And so we helped with the planning. There's a lot of people, you know, a lot of countries have never really planned for an emergency outbreak. And that's something that the Global Polio Eradication Network is very, very good at doing. there we're vaccinating. We go to that area. So, you know, we do that as well. Let's see. So in terms of COVID, I'm just wondering, did anyone have any questions about that before I move on to a different topic in terms of polio and COVID?
Just a general question, it may not fit, but what is the date for World Polio Day this year?
It's October 24th, and you know, it's still going to be celebrated. We are back vaccinating again, as you've probably heard. We're back arranging national immunization days. Along the way, they've set some systems. There are a few places, if COVID is really high, that they'll take a pause. But overall, we are back out doing national immunization days. Certainly, we are doing the vaccinations in the clinics, and we're also strengthening immune systems with providing vitamins and the other vaccines that kids need. So right now, when they go out, though, they're taking hand sanitizer, mask, cards. They have cards done in languages that show people, you know, how a virus spreads and about distancing and hand washing and not touching your face. And so those are some of the things that the polio workers are now lugging along with them in terms of also carrying vaccine. Now they've got these other things because we really want everyone to be safe. So if COVID ramps up in a certain area, they'll postpone it, but otherwise we're continuing to go out. I do not know our district plans. I've heard there's something big happening on the 24th, but I'm not privy to what it is, but that is the day of World Polio Day, and certainly Rotary International will make it a really big celebration. And clubs should be planning now because it's difficult with all of us meeting in Zoom. It's difficult to think about how are we going to do that public awareness and raising funds in the midst of a pandemic. And that's certainly what we'll be doing probably for several more months. But we've been very successful. From our district, I can tell you that at the end of the year, one of the things that we did here in District 6380 was the money that would have been used for the district conference. Sparky had allocated that to the polio campaign. And then Jane, at the end of her year, had some funds left over that the full accounting wasn't done until this year. So that leftover money also went into it. So we also had some very large legacy donors. That doesn't happen every year, but we lost some big players in our district this year. And some of them were people who had considered polio in their legacy. And so we had some legacy donations that went in during Sparky's year. So our district looked really good. I mean, our number was like 2.5 times what it normally is, which leads a challenge because, of course, everybody's going to be looking at District 6380 for next year to match that number again. And so that leads a challenge. So so let's just move on and talk about where the future is for polio a little bit. The future is still the same. It still costs from $3 per child to fully vaccinate a child. It's about 60 cents a dose, but we know we give them multiple doses. We still are involved with the Bill and Melinda Gates campaign. They're still matching us. So you give $1, they give $2, that makes $3. But we need to raise $50 million to continue that match. So they will be looking at all of our clubs. They are, Rotary International is asking clubs to consider $1,500 per club to go towards the polio campaign. They're also asking each district to do 20% of their DDF, their district designated funds. And then they're really trying for something this year that Rotary hasn't yet been able to accomplish. Believe it or not, only about 9% of all Rotarians individually donate money to polio. And here it is, our largest health initiative that Rotary has. So this year they're trying to get every Rotarian on the books, just for whatever amount they can donate. They just want to try and get everyone in there. And at the same time, that will help to get them used to going to Rotary.org and learning how to donate there, or seeking out, you know, through their foundation team, how to donate by snail mail. But I personally find Rotary.org to be the easiest way to go in and donate. So when you go there, you know, you can choose to donate to the foundation or to polio. And what they're asking is just $10 from every Rotarian in the world. And it would make an amazing difference in the polio campaign if we could accomplish that goal. So, so that's one of the things that they're looking at. Our biggest concern for the coming year is Pakistan. Pakistan is, you know, Afghanistan is coming along, but Pakistan is an area that we're watching. We found some remote areas where children had never been vaccinated. And so now we're going in and we're trying to do that. We know that 1 in 200 children who get polio will have an irreversible infection. In other words, it will leave them handicapped in some way. And for a good number of them, it will be their breathing muscles. And while they may not have died from the initial infection, about 5 to 10% of those children will die at a later date from breathing issues. And so that is a big concern. We know that malnourished children have compromised immune systems. So we're looking at, you know, talking about nutrition, certainly educating parents about proper nutrition when we're out there. You know, viruses can't live without a host. So that's the goal. Let's not leave anybody out there who's under-vaccinated, or any community that's under-vaccinated. So that's why we continue to do the surveillance and the testing, and just trying to, you know, see where polio is in the soil. And then we know we've got to go to that area and focus on that area. And that's still going on. Even during the midst of the pandemic, we were able to do that. Did I see a question? I thought I saw a question, maybe not. Okay, so that's what we're looking for this year, is just asking everyone to get on board, ask your club members to get on board with a $10 donation. That would be an amazing feat if every Rotarian did that. I can't even imagine how that could be accomplished. So I'm looking to see if there's anything important that I forgot about the whole COVID thing. 18 million children, 18 million people are saved every year by the polio vaccine. And we know that if we have to stop again, and it's for a lengthy period of time, that if we stopped vaccinating, if Rotary just said, we're done with this, we're going to walk away, within 10 years' time, we would see about 200,000 cases a year of polio, where there would be paralysis. So that's something to be concerned about. People have been asking me a lot about the United States pause on donating to World Health. And so I want to tell you that while it does affect the polio campaign a little bit dollar-wise, the biggest thing that we do with World Health is they are our health managers. They are the people that we go to get information and education from. So their contribution to polio, thank goodness, is more of a education and intelligence that we need from them. They help with data tracing and so forth. So there is a small amount of funding that came from World Health that does go towards polio. And we certainly will miss that and want to contribute and try and make up for it. But it is not going to have the impact that everyone's really afraid of. They are committed. They are not committed to the United States. They are committed to the polio campaign. So just so you know, it's not going to affect their involvement in the polio campaign. But it is unfortunate, and we hope that, you know, that we can see that turn around. There are 194 countries that have joined the U.S. in determining that they will take part in supporting the polio campaign. That means government support from those countries. So, we know that in a lot of the countries, the routine immunizations will go on based on government sources. But, we still have 18 million children every year that we vaccinate. We've vaccinated 2.5 billion children in the world. So we have a big responsibility going forward. And, we got to keep it in the forefront because with a pandemic, there's a lot to be concerned about. How do we get out there and vaccinate these kids if we don't have money? But with so many people not working, where do we get the money from? So creative campaigns like a wine tasting, a Zoom wine tasting. That's one of them. I'm trying, is there anything? So how can you help? Basically, fundraising and advocacy are the two big things that you can help with. And that's the most important thing we need. And so not just advocacy to people outside, inside Rotary, but outside in your communities and letting them know that polio is also a virus. And if nothing else, COVID-19 has shown us the damage a virus can cause. So let's not start it again with polio. So that's good. And then advocate within your club. See if you can get club members to add $10. So to the polio campaign, as well as your club doing the rate fundraising. Does anybody have any questions about what's going on out there now? And sure.
I have a question, Ginger. One of the things, I joined Rotary in '84. I think Judy Garver was my president. I think maybe same time or '88. I just remember. And we used to meet at Silverdome on Monday. I joined in '84. I have a lot of memories, and we used to talk about that 1 cent to how many polio doses can give in India. One of my always I never been able to get anybody from Pakistan community, not even joining, even talking about it, bringing them as guests. I don't know. Recently, actually, I'm teaching a student from Pakistan, from Sindh. So I'm going to call their parents.
I have a resource for you.
Okay.
My friend Suzanne Ray is World's Greatest Meal. Have you ever heard of that program? It's raised
What's the name?
World's Greatest Meal for Polio. She is a leader. Yeah, and are you on my Eradicating Polio page?
I don't know whether my name is there or not, but I met you several times.
Go to Facebook.
Okay.
And search for Eradicating Polio and ask to join.
Okay.
Suzanne often advertises on there, but she's on there. And she was the brainchild behind World's Greatest Meal for Polio, which is basically an advocacy of let's all get together, have a meal, and all of us will donate a little bit of funds during that meal to polio. And then you write to her, tell her what your group did, where they did it, and you send your money directly to the Rotary.org to Polio Plus, and they've raised thousands and thousands of dollars around the world. Here's something we would do on World Polio Day. Her husband is from Pakistan.
Oh, is that right? Oh.
So they spend half of their year in Australia and half of their year in Pakistan, and she knows every single high up leader on the polio campaign from Pakistan. So I want to put you in touch with her.
Yeah, put me in touch with that. Okay, that'd be great.
She herself would be a great speaker for you, but so she could also put you in touch with people who are, she's in Australia right now because of COVID.
Okay.
So they were in Australia when COVID came and then couldn't get back to Pakistan. They have a home in both places. So
I know
let's get in touch with her.
A lot of physical therapists are here. I've been in touch with them in the last few years. The home care company, and at least 10-20% owners are from Pakistan. But I'm not able to get anybody to a Rotary meeting or something. Maybe this is the time.
Oh, I can get you someone. That's a promise. That's a
Okay, that'll be great. Yeah.
Yeah, that's a promise. So again, you know, the Eradicating Polio page was something when I
Okay.
started helping the district with polio. I created this page about 7 or 8 years ago, and all it is an information page. So
Okay.
every week I post the numbers. You'll see them every Thursday, Friday, because they come out sometimes on Thursday, sometimes on Friday. But every week I post the numbers. Of course, I have a bunch of graphics on that page right now
Okay.
for Africa is polio free.
Okay.
Because I was
Yeah, of
really
course.
excited.
Yeah.
So everything that I put on that page is shareable. You can share it in your club, on your club's homepage. It's basically just a gathering spot for me to dump polio information that people might want to use to help others become more aware of what Rotary is doing. So,
Hey, Ginger, could you talk
Thank you.
to how, I don't know if it's Rotary or EndPolio Now or the EndPolio Initiative, but how the tracking systems are used with respect to polio, which is very pertinent for what maybe we should be doing if we're not actually doing it with COVID-19.
right. And that is the system that they have been tapping into. So polio in particular, and most viruses, will come out in the sewage systems. Well, in most of these countries, there is no sewage system, so it's in the soil. So we actually have dedicated workers who will go and collect samples of the soil and the sewage from the area and test for the polio DNA. And when they find it, then we know that there are circulating cases of polio in that area. And then we know to go in and vaccinate in that particular area. But also if there's an area that's been a particularly hot spot for polio and we're vaccinating, that's a way that we can track to see if we're having any effect. So we have people that are dedicated just to that part of the campaign, as opposed, they're not a part of the polio drop campaign. These are generally people who are involved in the world of science and like that, you know, kind of thing. But that's one thing that we've been doing for a long time. We track that way. The numbers then go into a big computer system, and that's something that they've utilized for COVID. And we can track, when we see an area, we track the movement of people from one area to another, and then we can watch for a potential outbreak in another area. So I think you might remember when we had some refugees a while back that we actually put a health station on the border to vaccinate people coming from one country to another. And there was a period of time when we had a problem where it was Pakistan, I believe. Maybe it was Nigeria. Nigeria was concerned about getting vaccine from the United States. So they stopped vaccinating. And we started to see some cases of polio rise there quite a bit, as a matter of fact. And the border countries around them started tracking. They wouldn't allow people to come into their country unless they'd been vaccinated. We were able to solve that problem by getting vaccine made in Germany. And that was kind of a problem that we had with government, as I said, misinformation that was just kind of spreading. But we still have some challenges with governments in Pakistan and Afghanistan, but we've really made huge progress, and they're on board now. And I think that's a big thing, that they're on board. You might have seen that Hold Your Neck was off in that area visiting and talking about polio right before COVID. He was over there, and they've had a lot of discussion. So,
And you also mentioned earlier whoever we is at the time, with immunization days or other vaccination programs, when they go in to do polio vaccination, they actually vaccinate whatever the country does as a matter of course. They do those at the same time to catch all the other diseases that the children are susceptible to.
And that's mostly done at the health clinics. So our workers are not carrying their vaccine, although I can tell you that we're carrying vitamins. We are doing that. But we do have health clinics where children can come. And, you know, one of the things that has happened, like India, for instance, they are polio-free, have been polio-free for a while, and the government has taken over the vaccination schedule, but we still provide vaccine. So it may not be 100%, but we provide vaccine. So we are still supporting, you know, I think a lot of times because we focus on Pakistan and Afghanistan, because they have active cases, that we forget to mention that we're still Rotary is still providing vaccine to 194 countries. So that's where we get the need for the funding for vaccine. It's primarily, that's what we're doing nowadays. A lot of the areas, the people that are going out to do the actual vaccinations are nationals from those countries. And a lot of that is for safety reasons, that it's nationals for those countries that are doing the vaccine. And we did have, you know, right before, you might remember, right before COVID even, we had a few attacks. One of our clinics was attacked. So it's not necessarily a safe job. You do not see Americans going in to Pakistan and Afghanistan on national immunization days. That's not happening. It's primarily, we're support. We're giving them vaccine, we're giving them education, we're helping with the computer systems in the vehicles, and the tracking and the tracing and all of those kinds of things. But we are not going out into their communities and vaccinating children. That's something that we're leaving to the people in those communities that have stepped up. And it's dangerous work. Like in Pakistan, the women that go out to vaccinate, they're very brave women to be out there vaccinating. They're targets, you know, so it's not an easy job.
No.
Any other questions?
Ginger, how many polio workers would you estimate are involved in this work in Afghanistan and Pakistan?
Oh my
And are they
gosh.
all volunteers? Is there paid staff too? I would assume, but.
There are government health workers that are paid, but most of the people that are actually administering the vaccine are volunteers.
Wow.
And I couldn't even give you a number. I mean, it's literally thousands and thousands of people in the countries around the world that are vaccinating. You know, we have our partners, and all of our partners are involved somehow in either fundraising or tracking and tracing and that kind of thing. So a lot of the organizations that are involved with us in the polio campaign, the people within those organizations are volunteering as well to do whatever they can. Like I said, World Health primarily is our medical expert. They're the people who help us coordinate the medical side of things. And, you know, they help us with how do you conduct a test, you know, and where do you store this data? So I know the Bill and Melinda Gates Foundation, they've been very helpful with the computer end of it, as well as financial. You know, a lot of people hear about the fact that they helped financially, but they've been helpful in other ways as well. So it's an exciting time for us in polio eradication, even though we're in the midst of a pandemic. We're really, really close. I mean, we're down to 2 countries again. And this time, I think we're really close. Our biggest challenge right now that they feel is Pakistan, and it's more in just the temperament of the country is a challenge for us. And that's going to be our biggest challenge. And, you know, of course, Rotary, that's why you saw Ginger and some of the others, they're going there and they're talking to government officials and kind of keeping them on board. It's getting the government to stay involved. And we've had commitments, like I said, I think this is the first time in history we've had commitments from Pakistan, from the government in Pakistan. So we, when we have our health clinics, those are run primarily by the health system that we've created, with a little bit of support from the areas. And we also detect and identify other problems that children have. And I don't think that's another area of the polio campaign that doesn't get talked about very much. But there are times when a child is diagnosed with something that there quite frankly isn't here in that country. And the Rotarians that are there will make arrangements to get that child somewhere where that health care is provided. We do a lot of really good things. Do you remember in India, we provided a lot of bicycles for the crawlers so that they could get around the country. That's something else we do. Mosquito nets. We provide mosquito nets in countries that helps prevent malaria. Our polio campaign is the greatest health initiative in the world. It is simply a system to be modeled. We do so much more than just fighting polio. And if we were able to eradicate polio, the economy as a whole, not just here in the United States, but in the world, would save billions of dollars in medical care, just in medical care for people who've contracted polio or have side effects from polio that they live with for the rest of their lives. So just think how much the United States has saved since polio's been gone here and the children aren't being paralyzed. I mean, you know, we all know, I know Farmington Rotary is very familiar with the fact that the Sister Kinney home became it just wasn't needed anymore. We were able to close it. And a lot of that was the fact that vaccine had been available for many years in our area. So they have a good history there to be able to share. And we did what, 3 open houses there, I think, and showed
3 years.
people, yeah, and
3
showed
years.
people what that facility was and what it did. So
Well, do we have any more questions?
One more.
Go for it.
Ginger, over the years, and I've been around a couple, National Immunization Day programs were much more in the forefront here in America, North America, not just the United States, where teams of 25, 30 people, Rotarians mostly, not all, would go to a site for an immunization day and do millions of immunizations. And that seems to be something that has drifted away. I don't hear anymore very much about groups going to participate. And I think that's all it is that we're not physically participating the way that we used to with the in-country groups.
that's very much true.
I can understand Pakistan and Afghanistan. That may not be the right thing, but happily it worked well in Africa, in the African countries. And so here's the result. Because it was an awareness thing. I was in Rotary a number of years during the beginning of the process, and just like now, the community isn't what I used to call a forebrain consciousness relative to polio.
And that's true. That's very true. There are still some groups, Rotary groups, and it's generally something that is arranged by a Rotarian who has connection. But there are still some Rotary groups that will join national immunizations in countries like India. But it used to be something that was organized more at an international level by Rotary International. And that isn't the case anymore because we got down to governments in those countries taking over. So Rotary wasn't arranging their national immunization day anymore. So Rotary wasn't advertising, this is going to happen on this date and we're going to do this, because now that's handled internally. And then because of the dangers in Pakistan and Afghanistan,
Right.
we couldn't do it there. The other thing I think too is the farther we get away from polio in the United States, the more people forget. But those people who went on National Immunization Days had a very strong awareness of what was happening in other countries, and they would come back and they would share that within their clubs, and it was really a great PR. So I think unless you're someone like me who had a family member who had polio, or were familiar with polio in that way, you don't really talk about it that much in the club. You don't hear about it like we used to. I know, just for instance, in the Novi Club, Dr. Samdi is, from India, did the J per Foot clinics, and Mike Rambus with the bikes. There always seemed to be a Rotarian somewhere that was connected to polio personally, and it made a difference. It made a difference in our awareness. We need to be out there more than we are. I don't think we're in front of our clubs enough with people that are experienced in knowing what polio is and what it does. And there's not enough time on a Zoom to tell everything I know about polio, obviously, what my life experience with polio has been. But that is the key part. It was a key part in keeping Rotarians engaged, is hearing the stories, which is why I told Ashok that I would for sure get him someone from Pakistan, because hearing from somebody who's in the forefront or knowledgeable about it is really, then his club, when they hear that on their Zoom, they'll share it, and they'll go out and say, I just heard this today on a Zoom.
Well,
So,
that's a good point there, Ginger. If there's no more questions, I just wanted to remind everybody that this meeting has been recorded and will be available on the Farmington Rotary website under the title Virtual Meetings Library. And you can come back and play this. You can actually make it an article for your club to view. These are all going to be left up there for some number of months. So that'll be available sometime early tomorrow morning, maybe even later today.
Okay, thanks. Great job.
So if no more questions, I'm going to press the end button. You all go about the rest of your day. Have fun. Be careful.
See you
Stay
later
safe.
in the evening. Okay.
thank you for
Thanks,
having me.
Ginger.
Yep.
Bye.
Bye, everyone.
Yeah.